The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Today we're holding our sixth hearing in this Congress on the opioids crisis. Joining us to talk about what is working in their states, Governor Larry Hogan from Maryland and Governor Kate Brown has come all the way from Oregon. And we thank you both for taking time from your very busy schedules to be here. This hearing is a follow-up to a roundtable that Senator Murray and I hosted last week with 13 governors who were here for the National Governors Association meeting. 32 senators of both parties attended at some time during that roundtable, which is a large gathering of senators to hear from the governors about the opioid crisis. Senator Murray and I will each have an opening statement, then I'll introduce the witnesses, then we'll hear from the governors and senators who will each have 5 minutes of questions. In January, I dropped by a meeting at the Tennessee governor's residence in Nashville. Governor Bill Haslam had invited the heads of all of our state's institutions who are involved in educating doctors, and they were planning how to discourage the overprescription of opioids. Governor Haslam told me that in our state of 6.6 million people, there were 7.6 million opioid prescriptions written in 2016. And that even though the state has reduced the amount of opioids prescribed to that still very high number, the number of overdose deaths is still rising because of the abuse of fentanyl, a synthetic opioid. In fact, according to a recent report from the Centers for Disease Control and Prevention, opioid overdoses spiked 30% between July 2016 and September 2017 across our country. So this is an evolving crisis that has affected nearly every state. But the specific challenges faced by Tennessee may be very different than from what Oregon or Maryland faces. States really are the ones who come up with the best ideas on how to tackle big problems because states are on the front lines. It's usually the federal government's role to encourage them to cut the red tape and to create an environment so that states and communities can innovate. That's true with addressing the opioids crisis. Governors are coming up with innovative solutions. They're leading the fight against specific problems their states face in the midst of the crisis. For example, Governor Hogan in Maryland have allowed all pharmacies to dispense naloxone, the drug that stops a drug overdose, and opened an opioid operations command center to coordinate the state and local government's response to the crisis. And Governor Brown has prioritized improving Oregon's prescription drug monitoring program and is working with the state legislature in Oregon on a peer mentorship program for individuals struggling with addiction. Congress also has taken a number of steps to support states fighting the opioid crisis. In 2015, we passed the Protecting Our Infants Act to help ensure that federal programs are more effective in helping expectant mothers struggling with opioid abuse and that they receive more help so that they have healthy babies. In 2016, we passed the Comprehensive Addiction and Recovery Act to give new authorities to states, including grants to expand access to naloxone and to provide a comprehensive response of education, prevention, treatment, and recovery. Also in 2016, we passed the 21st Century Cures Act and included $1 billion over 2 years in state grants to address the opioid crisis. Congress is considering, in the appropriations process, approving additional funding as well. In December, Senator Murray and I sent a letter to every governor and state insurance commissioner asking if these laws were working and how the federal government can be a better partner for states. We've heard back from 21 governors and 11 state health officials, in addition to the feedback we heard at the roundtable this week. Governor Haslam suggested additional funding to encourage states to share data in their prescription drug monitoring systems, something we talked about at our hearing last week. I think this is one of the most promising areas where the federal government can be helpful to states. Former Governor Terry McAuliffe of Virginia suggested we support research on non-opioid pain management. I've encouraged Dr. Collins, director of the National Institutes of Health, to use additional research money that Congress has appropriated to focus on finding a non-addictive painkiller. And Senator Murray and I have introduced legislation last month to give him more flexibility in funding to do that. This committee hopes to approve that piece of legislation as well as others later this spring so that we can recommend those bills to the full Senate to vote on. So it's helpful to have the input from governors here today, as well as the written responses from other governors and state commissioners. I'm looking forward to hearing what Oregon and Maryland are doing to address this crisis and what lessons can be learned. Senator Murray.
Well,